Hi, Mr. SL. I'm Dil, the student
Hi.
nurse practitioner. How are you doing today?
I'm doing good, thank you. And how are you?
Okay. So tell me, what brought you to the clinic today?
I have a difficulty to swallow, and I'm having sore throat, and I am having a headache and fever.
Now, when did this sore throat start, these symptoms start?
About 2 days back.
Right. How would you describe your sore throat and the headache, pain being 0 having no pain and 10 having the worst pain?
I would say it's 6.
And you just have pain with swallowing
Yes.
and eating and drinking?
Yes.
Now, have you had any other symptoms like ear pain, additional to the headache, any nasal stuffiness, any sinus pain, anything like that?
No.
Now, did you say that you had a cough?
Yeah, I am having a cough too. So it comes out with yellowish color.
Any other symptoms? Any generalized aching? Any chills?
No.
And you did check your fever with the oral thermometer?
Yes, I checked with my toddler's thermometer.
And did you take any medicine for the fever?
No, I didn't take any medicine for the fever, yes.
Okay. Any other symptoms you have been having?
No, I had 100.4.
Okay.
Yeah.
All right. Any recent exposure to anybody being sick?
My toddler's Montessori. We saw a notice that one of the child is having a
Like a strep throat?
strep throat.
Or something?
Yeah.
Okay. All right. Tell me about your childhood illnesses.
Yeah, I had mumps and chicken pox when I was 10 years old.
Okay. What kind of childhood vaccinations have you received?
I got measles vaccination, rubella, BCG.
Have you had the polio vaccine?
I got the polio too.
So you had the measles, mumps, and
Mumps,
rubella and
yes,
MMR
correct,
vaccine?
yeah.
Okay, and the BCG.
Yes.
All right. Did you have any reactions to those?
No, but I have a scar on my right arm.
Okay. Now, have you received the flu shot in the past years?
Yes, I have been regularly taking flu shots every year, but this time I'll be getting it next week.
Okay. You had no reactions?
No reaction for the flu shots. So far, so good.
All right. Tell me about your current medical problems.
I have diabetes, and I'm having.
Was the diabetes recently diagnosed, or how long have you had diabetes?
I have been having diabetes for 2 years now, and I have thyroid.
Low thyroid.
Low
or
thyroid.
hypothyroid?
Low thyroid.
Okay. So it's low thyroid.
Yes.
Okay. Did you ever get any blood work done for the thyroid or the diabetes?
Yes, I got it done.
You got an A1C for the diabetes?
Yes.
And do you happen to remember what it was?
No, I'm sorry, I don't remember.
All right. And you got the thyroid levels checked, and
Yes.
they put you on the medicine.
Yes.
And we'll talk about the medications. And any other medical problems other than diabetes, thyroid? Any asthma, lung problems like COPD, any high blood pressure, any heart problems?
Thank God I don't have those.
Okay. Any sleeping problems and
Yeah, that's right. Good point. I have difficulty in sleeping.
Okay.
And I'm taking medicine for that, over-the-counter medicine.
Okay. Now, have you been diagnosed with sleep apnea or use oxygen at night to help you sleep? Or
No, I'm not taking anything like that.
And do you take over-the-counter medications?
Yes.
We'll go over that medications in a little bit. So you just trouble falling asleep?
Yes, I have difficulty in falling asleep.
All right. Any other past hospitalizations and surgeries have you had?
Yeah, I would say my appendix is removed about 5-6 years back, and I was hospitalized for when I got dengue fever. For 4 or 5 days I was hospitalized.
Okay. Tell me, when you had the appendix removed, did they put you to sleep? Did you have general anesthesia?
They put me to sleep,
Okay.
general anesthesia.
Did you have any complications from it?
No.
Okay. Now, when you were sick with the dengue, you were just in the hospital for a few days?
Yes.
Okay, and they just, and did they give any, did you have any blood transfusions?
No, they didn't give me blood.
You have any history of any blood transfusions?
I have donated blood, but I haven't.
Okay. Do you happen to know your blood type?
Yes, it's A positive.
Okay, all right. No other surgeries other than the appendectomy?
No, any other surgeries.
All right. Tell me about your allergies, medication allergies and food allergies.
Right.
Start with the medication allergies.
Yeah, I'm allergic to penicillin, and food allergies. I'm allergic to ginseng.
Okay. Tell me what kind of a reaction do you have for the penicillin?
Itching and hives.
Okay, just general all over. Okay.
Yeah.
Then what about the reaction to the ginseng?
Yeah, the same thing.
Same thing.
Itching and hives.
Okay. Let's any other environmental allergies like pollutant, like pollen, any kind of dust, dandruff, anything like that? Any allergies to environmental?
No.
No. Okay. Let's talk about your medications. Now, you told me that you take some medications for diabetes, low thyroid, and for sleep. Let's go over those medications. What do you take for diabetes?
Oh, for diabetes, I take glucophage 500 milligram, and for thyroid, I take levothyroxine 25 microgram.
Tell me, how often do you take the glucophage 500? Is that every day, twice a day?
Every day.
Every day. And do you take it with meals or before meals?
Take before meals.
Okay. And what about the thyroid? You take it once every day?
Yeah, I take it every day.
Okay.
Levothyroid. Yeah.
Every early in the morning, or at what time do you take thyroid medicine?
Thyroid it takes early in the morning, and when I have difficulty in sleeping, I take melatonin. Not every day.
As needed.
As needed.
How many?
2 tablets. I take 2 tablets, 5 milligram. 2 tablets.
2 tablets.
As needed. Yeah.
As
at
needed.
night. Yeah.
That's not on a regular basis.
Yes.
Okay. Is there any other herbal medications you take and over-the-counter medicines that you can think of? That
I can't remember those days. I have been taking the what do you call bitter gourd lemon.
Bitter melon.
Bitter lemon.
Okay. All right. Is that, do you take it on a regular basis or occasionally?
Occasionally.
Okay. No other over-the-counter medicines you can?
No.
Okay. Tell me about your family history. Let's start with your immediate, your mother and father. Are they alive?
Yeah, they're alive.
All right. Any medical histories that run, like high blood pressure, diabetes, thyroid, or cancer?
My father had a stroke recently, and he's having a high blood pressure, and mother also having high blood pressure and diabetics.
Any siblings in your family?
Yes, I have 2 brothers and a sister. They are not diagnosed with anything.
Any aunts and uncles?
I don't have their history. I don't know about them.
That's all right. Okay. Tell me about your maternal and paternal grandparents. Do you know whether they had any kind of diseases like that, or they're deceased? Or?
They are deceased, so I have no idea about them.
And you mentioned you have a toddler.
Yes.
Any diseases that your toddler might be having current?
Not that time. No, he had a seizure. I remember.
Okay.
That's all.
Right. Let's talk about your diet. Do you follow a regular diet or a diabetic diet?
I follow the regular diet.
Okay.
But I'm very much concerned about sugar.
Okay, so you limit your sugar intake.
Yes.
Now, do you do carb counting and sort of things like that?
I don't do carb counting.
All right. Now, how often do you check your blood sugars?
Once in every 3 days.
Every 3 days. Okay. Do you have a glucose monitor at home?
Yes.
And how much caffeine do you take? Like, do you drink tea or coffee?
I usually drink tea in the morning, every day in the morning. And when I go to work, I some days I drink coffee.
Okay.
Not every day.
All right. Now, do you have anything like lactose intolerance, or do you use gluten-free products, or are you allergic to gluten?
No, I'm not allergic to gluten-free products.
Okay. You don't use gluten-free products?
No, I'm not using anything.
Okay. All right. Let me tell me about your exercise. How often do you exercise?
I go to gym once in every week, and I do exercise about 25-30 minutes. Mm-hmm. And I play with my toddler all 5 days.
Okay.
All 7 days.
Okay. All right. Do you smoke?
No, I don't smoke.
What about alcohol? Do you take alcohol on a regular basis?
Occasionally I take alcohol. About one beer or 2 beers.
The social one.
I'm a social drinker.
When was your last drinker?
Last Saturday, I believe.
Okay. Do you do any other drugs? Street drugs?
No.
Okay. All right. Tell me about your current living situations.
I happily married with my wife and I have a toddler. Mm-hmm. So we are leading a good family life. Happy and peaceful.
All right. Let's talk about safety a little bit. We're going to talk about work and home also. Any kind of safety issues in your home situation? Like, do you live in an apartment or a house?
I live in a nice house, in a nice community.
Safe, pretty much.
Safe and nice community. We enjoy our house and the community.
Okay. Tell me about your work situation. Do you have any exposure to any asbestos, hazardous stuff, pollutants, any fumes, anything like that?
Oh no, I work in an office.
What kind of work do you do?
So I work on computers. So you should always look at the computer screen. So
just using the computer and your
yes.
keyboard quite often.
Yes.
All right. Do you want to tell me anything else about safety at home? Do you feel safe in your current relationship? Any issues, concerns that you want to tell me?
No, I'm very comfortable and very safety.
Okay. You said that you and your toddler, you feel safe in your homes?
Yes.
Okay. No other
we
concerns?
both are very safe in our home.
No other concerns or issues?
No.
Tell me, let's talk about the spirituality a little bit. Tell me about your spiritual practice. Do you have support from family, community? Do you use this community for your spiritual practices?
When it comes to spiritual, I usually follow the Buddhist philosophy. Mm-hmm. By birth, I'm Buddhist, and I don't get much time to practice the Buddhist philosophy. But whenever I get chance, I go to the temple.
Okay. And you go sometimes.
Yeah.
And you feel like you have enough community and family support?
We don't have much family support. Basically, me, myself, my wife, and toddler only.
Okay. All right. Tell me about any other concerns you might have that you want to tell me. Have you had any history of suicidal history or any current suicidal thoughts, anything like that?
No, I haven't had any feeling to kill myself.
Okay, not in the past or no current
thoughts
or anything. That's good. All right. Tell me what else? Tell me about have you had anything else you want to mention? Financial concerns. Like, do you feel like you have enough financial resources to afford your medicines, your supplies, the diabetic, things like that, and your medications? Do you feel like you have enough?
Yes, because me and my wife both are working, and I have one child. So far so good. We manage our financials, so I have no issues with that.
All right, Mr. Sel. Anything else you would like to add about?
No, I think you covered everything, so I don't have anything left to tell you.
All right, I'm going to go over review of systems with you. So tell me, have you had any fatigue, weight loss? Like you said, you have a little bit of chills, but other than that, any fatigue, weight loss?
No, I haven't had anything like that. No, no fatigue, no weight loss, nothing.
Okay, no night sweats.
No night sweat.
Okay, all right. Tell me about your skin conditions. Have you had any open wounds that are not healing in the body? Any rashes? Any itching? Any change in color, pigmentation of the skin? Any moles? Anything that you have noticed of the skin that are like lumps or bumps, anything like that?
No, I don't have anything like that.
Okay. Have you had any dizziness, any passing out, any fainting, any recent head trauma or seizures, or just any shakes, tremors, anything like that?
No, I haven't had anything like that.
Okay. All right. Have you had any blurred vision, any double vision, any nearsightedness, farsightedness, anything like that in your eye?
No, I got my eye checked recently, so.
Okay. And do you wear glasses or contact lenses?
I wear glasses only when I'm reading only.
Reading only.
Yeah, I have a computer class for the computer.
Okay.
So apart from that, I'm not using any glasses or contact lenses.
Okay. So have you noticed any drainage, any redness, watery, itchy eyes? Do you use any kind of eye drops?
Eye drops, yes, I use when my eyes get dry, tired. The doctor recommend me to put some eye drops. That's it.
But no familial eye disease, glaucoma, cataracts, anything like that?
No.
Right. The hearing. Do you have any ringing in the ears? Any drainage coming from the ears, or hard time hearing? Any a cerumen that's covering that you have to quite often take out from a cotton tip? Or
I usually use a cotton tip to clean my ears. Other than that, I don't have anything coming out, and no issues like that.
No hearing problem.
No hearing problem.
So, do you put any ear drops for anything like that? Any frequent ear infections you might have had in the past?
No, I haven't had any ear infections.
So no problem with the ear. So the nose. Do you have any nasal fractures, anything like that in history? With no head trauma or anything like that either?
No, no head trauma.
Okay. Do you feel like you can have a good sense of smell? Does that the ability to smell things?
Yes. I have ability to smell. I have no concern or no problem with my nose.
Just a little bit of nasal stuffiness.
Yes.
Okay. Any polyps removed? Anything like that?
No.
Nosebleed?
No nosebleed.
Okay. Lips. Like, do you have any dry, cracked lip sores that you have noticed?
No,
any
when it gets dry, I use that balm. That's
Moisturizer.
Moisturizer. That's it. No, apart from that, I'm not using anything.
Any bleeding in the gums, anything like that?
No, no blood.
Okay. Do you use dentures, or do you have any tooth extraction done, or use crown? You have crowns or anything?
I don't have crowns, but I have tooth extractions done last few years back. About 4-5 tooth has been extracted in my mouth.
They were just you have any pain and some cavities?
Yes.
Okay. All right. Do you have any changes in your taste?
No.
In the tongue? Like, do you have any?
No taste in my tongue, and I taste every taste.
Okay. Any hoarseness? Just addition to the sore throat? Any hoarseness?
No, just the sore throat. I had been having for 2 days. That's all. Okay. Other than that, no sore.
Any sinus pain, of like sinus draining?
Not sinus draining, but I have the yellowish color things coming out. That's all.
Right. Have you had any neck stiffness?
Like, no, not
maybe moving it, like bending your neck, anything like that?
I don't have any difficulty in bending my neck and turning my neck.
Have you felt like any enlarged lymph nodes, like in the neck area and in the axillary area? Okay, I've noticed.
No, I haven't noticed anything like that.
All right. Your breathing. Have you had any trouble, shortness of breath with resting or with exercise or activity? We have difficulty breathing.
No, I haven't noticed anything like that.
All right. Just coughing up some.
Yeah, I have coughing up sometimes when I'm coughing, the things coming out. That's all.
Any wheezing?
No.
You don't use any oxygen or anything?
No, I'm
like
not
that.
using anything.
Have you had a recent chest X-ray or a TB skin test done?
I got my chest X-ray in 2014 before coming to US in Sri Lanka, and that's all. I haven't. Yeah.
And negative chest X-ray and PPD.
It's negative.
And no
yeah.
weight loss, no night sweats, no anything like that.
Yes, no night loss, no weight loss, nothing.
Okay. Now, have anybody told you have irregular heart rate or a murmur?
No, nobody told me about murmur.
Have you had any history of chest pain or current chest pain?
I haven't had anything like that.
No current chest pain.
No
history.
current chest pain.
No history of heart attack.
No, not yet.
No stress tests done in the past. Cardiac catheterization done.
No, I haven't done.
Okay. Any other no irregular heart rate even? No.
Yes.
Okay. Any kind of abdominal pain, nausea, vomiting, diarrhea we had recently?
No.
Any travel outside the United States in the past couple of years?
Out of years, yes. No. Out of state, yes.
Yeah. Any history of Clostridium difficile?
No.
C. diff, like having diarrhea?
No.
Been diagnosed with like that. Do you have noted any bloody stools?
Bloody stools? No.
Okay. Do you have hemorrhoids or any anything like that?
No.
And how is your bowel habits? Do you go to the bathroom on a regular basis for bowel movement, or do you use medicine for it?
No medicine needed. I have good bowel movements.
And you mentioned you have no lactose intolerance or no gluten allergies.
No gluten allergies, no lactose intolerance.
Okay. Tell me about, do you have trouble going to the bathroom for urination, initiating it, or like having burning, frequently going at night, or frequently going?
I had urinary tract infections.
You had frequent urinary tract infections?
2 years back.
Okay.
But I had been having it for about a year, I think.
And you were treated with antibiotics?
Yeah, I was treated with antibiotics, and doctor recommended me to drink more water.
Yes.
So that heals me a lot.
Just drinking.
Yeah.
Do you feel like you're emptying your bladder completely?
Yes.
Okay. All right. Any other testicular pain, or just do you have trouble having erection and maintaining it? Any history STDs, sexually transmitted disease?
No, I don't have anything like that.
Okay.
No STDs, no erection problems. No.
Okay. Tell me about your sexual practices. Are you satisfied with you have any problems with anything that concerns you?
No, I'm very much satisfied.
Okay.
And I have no issues.
And you have no testicular pain, no prostate problems?
No prostate problem, no testicular.
No infertility issues, anything like that? Okay. Do you feel like in your legs, when you walk, you have a lot of pain in your legs with resting and walking?
No. No pain in my leg. Yeah.
Any swelling?
No.
No swelling?
No smelling.
Any? Have you had any blood clots in the legs in the past?
No, I haven't had any blood clots.
Any varicose veins, anything like that?
No.
No bleeding, no bruising?
No bleeding, no bruising.
Have you had any history of anemia?
No history of anemia.
With no blood transfusion?
No,
You have given blood?
I have donated blood.
Okay. Tell me about, do you have any kind of mental health problems like bipolar, anxiety, schizophrenia, anything like that, anxiety, depression?
No.
Be diagnosed with anything like that?
No, I don't have anything like that.
Okay. Anything else you want to tell me? Any concern? Let's go over some tests. Have you had any kind of colonoscopies recently?
Yeah, it's negative.
You had a colonoscopy?
Yes.
Okay. Now, have you noticed any kind of lumps in your breast, any nodules you felt,
No.
any problems with like that?
No.
Okay. Tell me if anything else you need to tell me at this point about that you forgot to mention.
Let me think. No, I think you covered everything.
All right. Well, thank you very much,
You're
Mr.
welcome,
Sel.
ma'am.
And I'll see you soon with the physical assessment.
Sure.
Okay.
Thank you.